Hello, I'm so glad to be able to talk to you about this topic. Today I'm going to be talking to you about using acceptance and commitment therapy to address race-based trauma in Blacks. But first of all, let's talk just briefly about why this problem in the first place. Even before COVID-19, even before the George Floyd incident, African Americans have had the highest rates of trauma in the United States. For instance, findings from the U.S. Department of Justice show that African Americans are more likely than whites or Hispanics to be victims of violent crimes, such as assault. In addition, in a national U.S. NIMH-funded study, which was called the Collaborative Psychiatric Epidemiology Study, it was found that African Americans more frequently met criteria for post-traumatic stress disorder than white Americans, Hispanic Americans, and Asian Americans. And so I'm sure that social justice cries out and has reached the ears of the entire world by now. So it is known that African Americans suffer more fatalities by law enforcement than other races. There has been studies that show that Blacks have a fatality rate due to lethal force by law enforcement of almost 3 times higher than whites. So given the high rates of PTSD in this population, there should be hopefully some interventions out there that could help African Americans heal from chronic and acute trauma. And as an intervention, acceptance and commitment therapy, also called ACT, it does have some benefits that are appealing to African Americans. So for instance, ACT is evidence-based, and it shows potential in treating trauma in Blacks because, for one, it's a non-pathologizing approach. Other approaches like CBT, for example, have a goal of a reduction of symptoms. For instance, the goal of CBT is to reduce negative thoughts. So often a client needs to have a diagnosis in order to do that, such as depression or anxiety, to begin work reducing the behaviors and thoughts that are associated with the diagnosis. But ACT is non-pathologizing. And so it's different in that a client doesn't need a diagnosis in order to begin treatment. Instead, what ACT does is it promotes the understanding that suffering is just a part of the natural human condition. It's not a dysfunctional or dysfunctional diagnosable condition. And so ACT normalizes suffering, it normalizes pain, and it normalizes avoidance as normal human responses. While at the same time, what ACT does is it helps individuals to move toward more value-driven living. And so based upon the prior research, the normalization and destigmatization of the human experience has been noted as appealing to the African American community. So we know that ACT highlights the ubiquity of human suffering. And what ubiquity is the state or capacity of being everywhere, especially at the same time. And so suffering in ACT is seen that way. It's present for every human, and suffering is really not just an outlier, it's a normal part of life. And there's actually something soothing and normalizing in realizing that pain is just a part of life for all humans. So science says, and the ACT research says, there are a number of factors that influence the experience of suffering. And you can look and see that these are some of the factors that influence the experience of suffering. So we have genetics, we have lifestyle, life stress, social factors, beliefs about pain, gender, depression, anxiety, long-term health problems, fear of pain, and past pain experiences. All of these things influence the experience of suffering for all people. However, there are additional factors that influence the experiences of African Americans in the United States. And when you look at the social determinants of health model that's been adopted by the World Health Organization, we can easily see that there are additional factors besides the universal factors that I just mentioned that are important to address in treatment with African Americans. And so according to the United States Center for Disease Control, or the CDC, the social determinants of health are conditions that affect a wide range of risks in terms of health and outcomes. Determinants include life-enhancing resources such as food supply, housing, economic and social relationships, transportation, education, and healthcare. The distribution of these resources across populations really does effectively determine length and quality of life. And so based on the World Health Organization's definition, the social determinants of health are the conditions in which people live, are born, they grow, they work, and they age. And so these circumstances are all shaped by the distribution of money, of power, and resources at a global, national, and local level. As we look at the influences on suffering, and I mentioned the influence of suffering that are universal, these are some factors that influence suffering for African Americans, in addition to those things that we just mentioned. So access to care, illness chronicity, life stress, cultural competence, cultural spiritual beliefs, racism and discrimination, socioeconomic status, police and prosecutor bias, stigma, cultural distrust, and past pain experiences. These are all factors that influence suffering. And so I want to go into more detail about these social determinants of health that affect African Americans, because really all of these directly influence the experience of suffering in this population. So when we look at healthcare disparities, so healthcare disparities, they refer to differences in access or differences in availability of facilities and services. And so when you apply this definition to mental health, it's saying that there's differences both in access to mental care and quality of mental health care for individuals based on their socioeconomic, geographic, or racially, ethnically defined groups. And so disparities in behavioral health services for members of racial and ethnic minority populations include the fact that they might be less likely to have access to available mental health services. They might be less likely to receive necessary mental health care. They are definitely significantly underrepresented in mental health research. And they often receive a poorer quality of treatment. So there's lots of research that talks about misdiagnosis in this population. When we talk about illness chronicity, as a group, African Americans, they do bear a disproportionate burden of health problems. So you have higher mortality rates, higher rates of diabetes, heart disease, prostate cancer, breast cancer, infant mortality than others in America. And then also recent research has shown that African Americans have higher rates of dying from COVID-19 complications if they get COVID than whites, Asians, or Latinx population. So all of us experience life stress, and of course we all have a common experience of life stress right now, as we all are addressing and dealing with COVID-19 in our own way. However, life stress is also affected by intersectionality. And so intersectionality is defined by Dr. Kimberly Crenshaw as, quote, overlapping or intersecting social identities and related systems of oppression, domination, or discrimination, unquote. And here is another quote by Dr. Crenshaw. She basically says, if we aren't intersectional, some of us, the most vulnerable, are going to fall through the cracks. In terms of cultural competence, although African Americans make up approximately 15% of the U.S. population, less than 5% of the mental health workforce in America is African American. And what that means is that African Americans, if they do receive services, they're going to receive services from therapists of all races and ethnicities. And so it's hoped that those therapists do have a bit of understanding about the African American experience through some level of cultural competence. It's also hoped that those therapists are open to learning through cultural humility. In terms of cultural and spiritual beliefs, it's definitely true that cultural and spiritual beliefs shape beliefs about mental health treatment. Some individuals do not believe that mental illness is caused by genetics or biological propensities towards disease. Some individuals do not believe in mental illness at all, actually. Instead, some people believe things like mental illness is not real. It's a socially constructed fabrication to sell pharmaceuticals. Some people believe that mental illness is due to a morality issue, sins of the person. The person can change. They just made a decision about their behavior. Some people believe that mental illness is caused by too many life stressors, death, loss, grief, trauma. Some people believe that mental illness is caused because the person is weak or there's an inherent weakness in the individual. Some people believe that mental illness is demonic, or it's due to witchcraft, a hex, or sorcery. And some people believe that mental illness is just another label that the dominant culture gives to oppressed populations to keep them under their thumb. And so there's a multiplicity of beliefs about mental health and mental illness, and we have to take those into consideration as we treat individuals. So racism and discrimination is part of the social determinants of health, and racism is defined as, quote, a system that categorizes and ranks social groups into races and differentially distributes resources and opportunities to those groups based on their perceived inferior or superior ranking. And so what racism does is it results in the devaluation and disempowerment of racial groups that are classified by society as, quote unquote, inferior rather. So there is a theory or framework called the Race Forward's 4 Levels of Racism framework. And what they believe in that framework is that racism takes on the shape in 4 different ways. So internalized racism, interpersonal racism, institutionalized racism, and structural racism. A lot of times the conversations that we have on racism focus on the individual level, which is either internalized or interpersonal. However, systemic racism, which is either institutional or structural, is an even more pervasive driver of the poor outcomes faced by communities of color. Socioeconomic status, another part of the social determinants of health. And so we know already that socioeconomic status affects a person's pain and suffering journey. So lower SES, lower levels of education, being unemployed or underemployed, poverty, homelessness, all of these statuses affect a person's experience of pain and suffering. Police and prosecutor bias. I'll just say a few names. I'm not, of course, going to be able to say hundreds of names, but George Floyd, Minneapolis, Minnesota; Sean Reed, Indianapolis, Indiana; Breonna Taylor, Louisville, Kentucky; Atiana Jefferson, Fort Worth, Texas; Elijah McClain, Aurora, Colorado; Charlena Chavon Lyle and her unborn fetus, Seattle, Washington; Philandro Castile, Falcon Heights, Minnesota; Alton Sterling, Baton Rouge, Louisiana; Sandra Bland, Waller County, Texas. It goes on and on. Cleveland, Ohio; Los Angeles, California; Ferguson, Missouri; Berkeley, California; Staten Island, New York. Thousands of deaths in the past decade. And these are just the ones who were found out These are just the ones that were within police custody. These are not even counting those who were critically or forever injured. Stigma and cultural distrust. So an additional challenge when working with the African American community is their use of mental health treatment. So it's well documented that African Americans underutilize mental health treatment. And in general, most adults with a mental disorder don't seek treatment. So less than 50% of all adults in national surveys with a diagnosable mental disorder sought treatment within the 12 months of their disorder. But service use is even worse for racial minority groups. They're more likely to delay seeking treatment even longer than the general population. Past pain experiences. So there's a great need for research on lifetime exposure to adversities and trauma that include community samples of men and women from diverse ethnic and linguistic backgrounds. And in particular, there's a need to understand how early life trauma predicts negative mental health outcomes such as depression, anxiety, and post-traumatic stress disorder. I was a researcher at one time with the UCLA Center for Culture, Trauma, and Health Disparities, and Dr. Gail Wyatt was the head of that. And in a research manuscript by Dr. Wyatt and her colleagues, she mentioned that African Americans and Latinos, who often carry the greatest childhood exposure to adversities and traumas, are often underrepresented in these studies. So just think about, for a moment, the cumulative pain and cumulative burden of pain and suffering for some individuals. So what the social determinants of health would say is that it's important to take this pain history into consideration when you're doing therapy with a client from this background, that there may be multiple adversities or traumas that are impacting upon some individual's client's health. And so I'd like to introduce you to the ACT hexaflex, or the Acceptance and Commitment Therapy hexaflex. This is the process by which ACT therapists do their work. And so we work based upon 6 core processes that we target. We target acceptance, diffusion, values, committed action, contact with the present moment, and self as context. So when I say we target these, if a person is able to improve in any of these areas, then their psychological flexibility will improve. And psychological flexibility is tied to a lot of different outcomes. So psychological flexibility, the higher psychological flexibility you have, the higher quality of life you may have, the lower levels of depression you may have, the lower levels of anxiety, lower levels of trauma-based symptoms. But when you add the social determinants of health to this model, then you would get a model that is similar, looks similar, but will have a little bit different terminology. So it is what it is, freedom to let go, living life like it's golden, which is purpose, getting it done in the here and now, and I am more than my experiences. And it's the same psychological flexibility that's targeted. However, this is a culturally tailored model for traumatized African Americans. And what entails a culturally tailored model? There's a number of things that are a part of this new model. The model has the use of culturally tailored metaphors. So there's a number of metaphors that are used in acceptance and commitment therapy, and these have been culturally tailored in this model. Also, experiential exercises. So real life exercises, real-life practice-based exercises based upon what African Americans go through. Faith-based mindfulness is included in this particular model because there's a lot of research that shows that, of course, not every African American is of faith. However, faith is an important part in many lives of those who are African American. Reality-based role plays. So there's a number of different culturally tailored reality-based role plays that are integrated in this model. We've also integrated some biblical references and scriptures. And we really pinpoint the social determinants of health by ensuring that we address racism and discrimination, barriers to treatment, and addressing stigma and cultural views about mental health treatment into the model. And so if you'd like to know more about this model, feel free to visit my website at www.drjspayne.com, and I have more information there about the model. But we definitely need to do something about the trauma that's taking place in our communities. And thank you for listening.